Is World AIDS Day, a day to show support for those living with HIV and AIDS and to raise awareness of the fight against this devastating disease.
Well, and joining us today is Dr. Inrig, who is an expert in the field and the co-author of a book called The AIDS Pandemic. Stephen, thank you so much for joining us. Let's talk about a couple things. First of all, World AIDS Day, very important, but how are things standing right now with the HIV and AIDS crisis?
Well, we're actually at a very important point in combating global AIDS and the global AIDS pandemic. We've made a tremendous amount of progress, and about 50% of the world's population right now has access to some kind of treatment. And so the question is, can we sustain that and eventually really address the epidemic and slow it down?
And your book is about the World Health Organization's global response to the AIDS pandemic. What did you find?
Well, one of the things we found is that the World Health Organization has been poorly structured to respond to big global health emergencies. And so we kind of lay out some lessons learned about how, in many cases, they either fumbled the ball or donors kind of constricted the way they could do some things. And with things like SARS and Ebola, those are important things because we have global emergencies all the time that are coming up.
Wow. And let's talk about, you're the director of Mount St. Mary's University Health Policy and Management Program. How is your work there affecting the situation now?
Well, one of the things we try and do with our students, we have a large number of minority students, fantastic, excellent students who are trying to grasp the issues of AIDS and other health problems, learn how to tackle a problem, find alternatives. And so one of the things we're trying to think of with global AIDS, sometimes people would just find one solution to a problem, and it turns out that you need multiple solutions to be effective, and so we try and train our students to have a multi-focused approach.
And lately in the news, of course, so many sexual assault cases being discussed. How is that related to this problem?
Well, historically, HIV is spread among marginalized communities. Women obviously have been a key component globally, and oftentimes women do not have the social power to be able to tell their spouse or partner to put on a condom or to protect themselves, and so HIV often kind of preys upon the power structures in relationships. And this whole discussion we're having right now about sexual assault is about people in power who are taking advantage of their position to exploit people.
Wow, that was very interesting. I didn't think about that when you're talking about AIDS and HIV, about how that would affect it. Also, let's talk about the affordable health care. How is all of this talk right now in politics and changing health care affecting the way people can be treated as well?
Well, one of the key aspects, in at least domestically, but actually internationally as well, has been that people need access to care, access to health systems that can give them a continuity of care throughout their treatment. If you have HIV, we don't have a cure for that. And so people need access to health insurance. They need access to providers who can give them direction over a long term about managing their disease.
Maybe we could put a shameless plug in for APLA Health, because we are the media sponsor for AIDS Walk Los Angeles. They do tremendous work, so we need more organizations like that.
Sure do. And APLA was there at the very start, so it made a big difference.
Thank you so much, Stephen, for joining us. And you can learn more about the book, The AIDS Pandemic. It is available now. I think it would be a very good read as well.
Nice to meet you, and happy holidays to you.
Thanks so much.